one in Cabarrus. We've had 3 deaths with 1 under investigation. We know of 7 hospitalizations, at least a couple on ventilators. We have 14 cases connected to an outbreak at Madison Saints Paradise South Senior Living, which is across the street from the church. And we have 2 cases connected to an outbreak at White Oak Manor Senior Living at 4009 Craig Avenue. So this outbreak has not concluded. We are still seeing cases. We did mass testing yesterday and the day before. We will have those results by tomorrow. And also, as was mentioned, multiple conversations with the pastor with attempts to work with them to understand who all was attending these events that have led to this outbreak, as well as how we might work with them to prevent further outbreak. We've not been successful in that effort. There have been multiple conversations with the pastor, as well as several conversations between legal counsel. The revival that's planned this week runs from Sunday, October 25th, nightly through Saturday, October 31st. The opportunity for continued spread exists in this environment and is of grave concern to us. And as mentioned, there's no indication that they have plans for changing the dates, times, postponing anything around this. I want to give you just a little bit of information about what an order of abatement of imminent hazard is and what gives me the authority to do anything with this. General Statute 138-2 defines imminent hazard as a situation that is likely to cause an immediate threat to human life, an immediate threat of serious adverse health effects, and if no immediate action is taken. So under 138-20, either the DHHS secretary or a local health director determines that an imminent hazard exists, the secretary or a local health director may, after notice to or reasonable attempt to notify the owner, lessee, operator, or other person in control of the property, enter upon any property and take any action necessary to abate the imminent hazard. I do not take this authority lightly. I have been in public health for over 30 years. This is the 3rd abatement that I have ever issued in my entire career. So to help you understand what we have asked of the House of Prayer, the order goes into effect at 10 a.m. this morning. And in that order, we declare that in-person gatherings at all House of Prayer facilities in Mecklenburg County until and including November 25th, calculated as a period of 14 days from the most recent COVID-19 exposure traced to that facility, constitutes an imminent hazard as defined. Under the order, all House of Prayer facilities in Mecklenburg County shall be closed immediately to in-person gatherings, and the United House of Prayer shall not hold any in-person gatherings of 10 or more people until the expiration of this order. In addition, the House of Prayer shall immediately notify its members and post a public notice that all in-person gatherings at House of Prayer facilities within Mecklenburg County are canceled until at least November 6, 2020. And lastly, we want them to take reasonable steps to clean and disinfect all indoor surfaces as mandated through our department, the North Carolina Department of Health and Human Services, and or the CDC. That order has been delivered to the House of Prayer. It has also been delivered to their legal counsel, and the expectation is that they comply as of 10 a.m. this morning. So that's where we are today. We hope that we will get compliance from this. We have grave concerns about the continued exposure, secondary exposure in our community, not just within the congregation, and believe that unless this is abated, we will continue to see increased infections in our community due to this behavior. So I will stop there now and take questions.
Brett Jensen, I believe you have the first question.
Thanks, guys. Gibbie, I know I've asked you a list about all through the summer, a lot about the nursing homes and congregate centers. Is that right now maybe your biggest fear, that because this has gone into other places like that, where the vulnerable population, that this could wreak havoc among those places? Is that your biggest concern right now?
Actually, that's one of my concerns. We have also seen spread throughout families from this event. And we have seen a death from a secondary exposure. So we believe that the risk to our community is grave and also reaches into any number of settings. Obviously, our long-term care facilities, we have individuals there who are at most high risk, and we are always concerned about them.
Next question. Any additional questions?
Yes, this is Savannah with NVCWCNC Charlotte. Could you explain a little more what the imminent hazard abatement order means and you know how often something like that is issued?
As I mentioned earlier, this is the third time in my entire career that I've used this authority. It has to be a grave and or severe threat to public health before we utilize it. And there's very clear statute around how we use it, when we use it. So it's not used lightly. The concern here, again, is the potential for significant exposure. We've already had 121 cases in Mecklenburg County. We know that without some significant intervention, we will continue to see that increase. And we are already seeing our numbers go up in Mecklenburg County. So it seemed that at this point, this was a logical next step, considering the fact that we have not had good luck working with the church at this point in time.
Christy O'Connor, do you have a question?
I do. Thank you. Can you hear me?
I can.
Yes.
Okay, good. I was wondering, this question is for Gibbie. With CMS going back to school the next 2 weeks and cases rising across the state, I was wondering if you're concerned about numbers going up overall, not just related to this outbreak here, but with students going back to school. Are you worried about those case numbers going up?
Well, we have been talking about our case numbers probably going up over the last month as we move into the fall and in flu season, as we've seen increased availability of options for people to be out in the community. We anticipated some increases, and as we've been seeing that happen across the country and in North Carolina, we anticipated that as well. So we are seeing that. This particular situation has created obviously additional cases for us to be concerned about, which means we have community spread. Yes, we are concerned about every situation, and any situation that brings people together right now puts them at risk unless they are wearing their masks and socially distancing and not putting themselves in situations they don't have to be in. So we are concerned about this, obviously very concerned about this particular situation. Schools are opening up. We're going to be watching that very carefully as well.
Destiny McKeever, you have a question?
Yes, can you hear me?
I can.
This is for Gibbie Harris. When you say the House of Prayer has been notified that they are not to have any services, have they responded saying that they are aware and that they will not have services?
We have not gotten any response to the order at this point in time. Excuse me. It was delivered to them as well as sent to them virtually through email. So they do have the order. We have not gotten any response at this point.
But we did have some conversations yesterday and did try to secure a commitment from the House of Prayer that they would cancel these upcoming events, and we were unable to secure a commitment. So, which is the reason why we really went to this next step, because we are very concerned about continued mass gatherings at the House of Prayer.
So possibly they will host church tomorrow.
It is possible.
The expectation is that they're going to comply with our order. That is the expectation, and we hope that they come to the right decision for themselves and do what's in the best interest of the public health and safety not just for Mecklenburg County, but for surrounding counties, and people come from all over the country to some of these events. So we're hopeful they will come to the right conclusion and make the right decision.
This is
Sorry, Savannah with CNC again. What if they don't?
Then we would have to proceed to go to court and get a temporary restraining order.
Brett Jensen again. I'm curious, when you guys have tried to reach out with them and offer the services of testing and everything else, have they just been defiant, just not accepting any of your calls? Like, how have they been reacting to all this? Like, have you guys been able to even speak to them?
There have been a number of conversations between my staff and with the pastor, as well as with the folks that run the facility across the street for the seniors. All of those conversations have been reasonable, but very non-committal. So we have gotten no, and basically what we've been told is that they have this under control.
So that's their explanation, is that's why they won't help out with the testing or anything like that. They think they have it under control.
That's basically what we've been told, is that they're doing what they need to do.
Next question.
Yes, this is another question. I'm curious, Gibbie. We saw yesterday about the memos that all the county managers received, and Dena and them confirmed that they did receive the memos from the governor's office and the health secretary, Mandy Cohen. Do you think at this point or any time in the very near future, restaurants should stop serving alcohol at 9 p.m.?
We're having conversations all the time within the county about how best to approach the situation and what might be most effective. I don't think we've not made any decisions about doing anything other than what's in the executive order right at this point in time.
And just to be clear, one of the main points that the secretary was trying to make is to try to give us tools in our toolbox that we could use here locally. And so currently the executive orders, any violation of those are criminal penalties. And so what her suggestion is, and we're looking at this, is if we pass ordinances locally, we'll be able to assess civil penalties or fines. And so that's one of the things that we're looking at, is whether or not we need to enact ordinances that would allow us to assess civil penalties as part of the enforcement process, again, to give us more tools in our toolbox.
And I don't know if this goes to Dr. Washington or Gibbie, but I'm just curious, has there been locally or even statewide a situation sort of like the House of Prayer where we've seen massive outbreaks due to a restaurant serving alcohol from 9 to 11 p.m.?
I'm not aware of any situations like that in the state at this point.
Hi, this is Glenn Perkins with Q City Metro. Given that there is a potential First Amendment issue here, how confident are you that you will be able to get a court order if they decide to defy and actually hold services?
Well, it's an interesting question, and we've had a lot of conversations around that. We feel very strongly that it's our responsibility to protect the public health and safety. If in fact we have to go to court and get a temporary restraining order, we will see, how a judge rules in this instance. So we feel good about the steps that we're taking, and we just want to make sure the public is aware that if in fact they don't comply, that people really should not attend because it's not safe. And so again, hopefully they're going to make the right decision and that they will comply with the order, but we will take every step necessary to try to make sure that people in this community are safe.
Thank you.
Other questions?
Yes, one more question. Q City Metro again. Can you just talk in general about what you're seeing in terms of houses of faith, churches in general, in terms of the spread of COVID?
So we, what we're seeing in the county is a wide variety of ways that churches have dealt with this situation. We still have churches who are doing nothing but virtual services. There's quite a bit of that. We have a number of churches who have come back together for smaller church services. And then we have churches that are back to quote unquote normal. We are seeing cases related to church service. And unfortunately, it's the church environment isn't always one where people continue to wear the mask through the whole service or socially distance. And any environment, regardless whether it's church, whether it's a party in somebody's house, whether it's a family gathering, where you're not doing those things, you're putting each other at risk. So we are encouraging churches as well as every other environment in our community and everybody in our community to wear their masks, socially distance, and try to avoid any type of mass gathering at all.
I know contact tracing was an issue for you guys earlier. How is that going? Do you think you've gotten almost everyone, or do you still have a ways to go?
Well, we still have cases coming in. We know we have new cases in the system this morning. Contact tracers are working those right now. So as long as this outbreak continues, we're continuing to work it. I will say I'm very proud of my staff. They, the types of systems and efforts that they've put in place over the last months have really helped us in addressing this particular situation in a very rapid manner and a very complete manner. So I am very confident that we're where we need to be right now, and we'll continue to work this particular outbreak as well as all of the other cases that are coming into the county at this point in time.
Other questions? Okay. Well, if there are no other questions, we want to thank you for joining us this morning. I hope you enjoy the rest of your day. And as additional information becomes available, we'll be sure to share it. Thank you.
Thank you.